Good morning, everyone. Welcome to the County Task Force 2023 Plan and Guidance Document webinar. Before we begin, I would like to turn this presentation over to Director and Deputy Commissioner Robert Macarone for welcoming remarks.
Thank you, Michelle, and good morning, everyone. I see we have almost 60 people on the call for August 30th, 2023. Whoever thought we could bring together almost 60 people on a Wednesday morning in late August. But nevertheless, we think it's important. Why did we pursue this? Because we recognize that time is of the essence, and you have a large task ahead of you, and that is to successfully budget, program, and begin to plan for a substantial increase in state funding for the County Reentry Task Force initiative in New York State. Whoever knew that receiving money would be so much work? But the truth is that we want to ensure that the dollars go and follow the evidence, and that they are wisely utilized by the task forces. Frankly, we've heard from the task forces saying, how shall we begin? For so long, you have done this important work on what I really think is a shoestring budget. And I want to just take the time at this moment to acknowledge the work that you've done through the years with no budget increases, and really done a spectacular job at serving individuals returning to our 20 communities in New York State. Now we have the funding, and we want to help you both budget and plan for the implementation of that substantial increase in funding. Statewide, we went from 3.8 million to 11.5 million. At least $2 million of that is reserved for implementing 15 new county reentry task forces. We expect that will occur in the coming months. But Michelle Clark and her staff and our leaders at DCHS, including Commissioner Rosanna Rosado, Executive Deputy Joe Popkin, and Deputy Commissioner for Strategic Planning, Dean DeTruccio, and myself, really lobbied vigorously to ensure that the existing 20 county reentry task forces receive this additional funding. So we're excited about this. I'm sure there could have been a better time, but Michelle and I have been working with Matt Charton, anxiously looking at that October 1st extension. And we wanted to ensure that you receive the money in time for that extension. We know what works in New York State. I recently visited the APA conference. Michelle presented a wonderful workshop on your work, represented you so well. And I'm sure she'll mention that in the future, next few moments, but it worked out really well. And the rest of the nation looked on, those in attendance of the New York State County Reentry Task Force. We are leading, you are leading the nation in the services you provide through the 20 county reentry task forces. So we want to take this time to reinforce what works, and then our staff will be busy during the next 2-3 weeks working with you in implementing that. We also have representatives from the Office of OPDF, Office of Program Development and Funding, and Office of Justice Research and Performance on the line to also guide this discussion. So welcome, everyone, and I look forward to learning as you do. Thank you, Michelle.
Thank you, Deputy Commissioner Macarone. So yes, thank you for the American Probation and Parole Association plug, and I want to thank Ms. Stacy Dorsey, Mr. Felix Gonzalez for joining me in that event this week. It was an exceptional event, and as Deputy Commissioner Macarone said, we did highlight the work of all the county reentry task forces across New York State for that national audience. So thank you again for your participation, Stacy and Felix. So without further ado, I'd like to introduce those of us who are going to be presenting today. My name is Michelle Clark. I work for the Office of Probation and Correctional Alternatives, and I manage the unit that's responsible for the county reentry task forces. And I'll turn it over to my colleague, Ben, and then our colleagues at OGRP.
Good morning, everybody. I'm glad so many folks could attend this webinar. We're looking forward to putting it out. So my name is Ben Lazarus. I manage the contracting unit in the funding office. We're the ones that will be working with you guys to put your contracts together and then come out throughout the year to do some site visits. Thanks, Michelle.
And OGRP?
Good morning. My name's
everyone.
Oh, sorry, Dean. Go ahead. Morning, my name is Dean Wild. I'm a program research specialist with the DCJS Office of Justice Research and Performance. I oversee our Community Corrections Data Submission Application, also called CCDS, which is our secure database for collecting case-level data from the DCJS-funded programs. And I will be chiming in on a few slides dealing with data and reporting later in the presentation. Thank you.
Good morning. I'll be quick. Shanley Corello. I manage the Community Corrections Research Team at OJRP, working with Dean and Jess. And we'll be talking about fidelity and briefly about logic models as well. And Jess.
Hi all, good morning. I'm Jess Henkel. I hope you can hear me okay. I was brought on for implementation and fidelity, mainly working in implementation science, utilization of logic models, and ensuring that programs are able to adhere to their plans with the programs or with the resources that they have available. Thank you.
Thank you so much. So just a few housekeeping things. I think we're all muted for the purposes of this webinar. We will be taking questions and answers toward the end. But if at any time during the presentation you have something you'd like to add or you're having any difficulty with the presentation, please enter your information in the chat and staff from OPCA will be able to assist you. Okay, so moving forward to today's agenda, we are going to start with an overview of the principles of effective intervention, addressing and talking about criminogenic needs as well as stabilization needs. And then we're going to get into the County Reentry Task Force work plan and enhancements. Up to about $9 million is allocated to fund the current 20 CRTFs, which includes existing awards and additional funds for enhanced staffing and stabilization services. So we're going to be talking about those things throughout this webinar. We're also going to be talking about the delivery of CBI and employment readiness, which is part of your work plan. We're also going to get into case file documentation, case level reporting, and fidelity logic model information that is going to be provided by the Office of Justice Research and Performance. And at the very end, as stated, we will have time for questions and answers. So in today's webinar, as I said, we're going to provide an overview of the effective interventions. We're going to talk a little bit about stages of change very briefly, because I'm sure you've all heard it many times, and evidence-based interventions, and briefly discuss the risk need responsivity model. We're going to guide you through the 2023 CRTF guidance plan and questions. We're going to talk with you about the number of individuals that we're going to serve, work plan review, a review of the work plan objectives, rather. We're going to assist CRTFs in considering the necessary enhancements to stabilization services for returning citizens, as well as discuss staffing needs and propose updates to the staff structure of the CRTFs. We're also going to have these conversations throughout the renewal process. Taylor Alfred from OPCA, as well as Melinda Vick from OPCA, as you all know, oversee the 20 county reentry task forces. They're assigned 10 each, and they will be working with you all individually to go over these pieces as well. So to start today, OPCA, understands in terms of working with programs that engaging participants in the CRTF services is challenging for a myriad of reasons. People want to live their lives the way they want to without intervention at times. They don't want involvement from systems, services, etc. But regardless of how many times we as human beings try to help ourselves, all of us, sometimes a helping hand is valuable. Sometimes change comes from taking the help, that we are offered. And sometimes this is really how changes occur. And speaking to the CRTF orientation video that I'm hoping you all have seen, this is what's so impactful about that, is hearing individuals who have gone through the task force share the information, how these task forces really help them to change their lives. So changing is difficult for most people, most of the time. These are the constants that we know. People who are motivated are more likely to make changes. And to change, a person must value the change. We also know, which is not on the slide, is that change is inevitable, which is a good thing. Next slide, please. So what works in community corrections? What we know is that evidence-based practices work for community for those involved in the criminal justice system. We know that. Evidence supports that. Scientific research supports that. And the use of risk and needs assessment, validated assessments designed by scientific research, are what we use to determine the risk level, the supervision level, and the needs of individuals. For the CRTFs, we are most familiar with the COMPASS reentry, as this is the risk need assessment used by New York State docs. Narratives and bar charts are provided for each referred participant. They're provided by docs to the CRTFs on all referred individuals. Moving down the list, cognitive behavioral interventions, for example, thinking for a change, the T4C booster, moral recognition therapy, and interactive journaling. Why do we use these? And the answer is because they're evidence-based, scientifically proven interventions that help incarcerated and formerly incarcerated individuals understand the thoughts and feelings that influence their behaviors. These CBIs are used to help participants deal with specific criminogenic problems or needs identified by the COMPASS reentry. Employment readiness programs such as Ready, Set, Work and the CBI employment program. These programs assist individuals in obtaining and maintaining gainful employment. Next slide. So the 4 principles of effective intervention: the risk, the need, responsivity, and program integrity principles. First, the risk principle tells us who we should direct services to. And the target population for, the county reentry task forces, we're going to go over within the next few slides. The need principle tells us what area we need to address to reduce the likelihood of recidivism. So we're connecting those risk factors, those domains where individuals score moderate to high. We're targeting them because those are the factors linked most to reoffending behavior. The responsivity principle tells us how we should work with someone to increase successes. It's responding to a person as an individual. Programs with the greatest impact on recidivism are cognitive behavioral interventions, they orient themselves to CBI and deliver services in a style and mode that is consistent with the learning style of the individual and the individual's level of motivation for change. And last but not least, the program integrity model, or principle rather. It's about providing quality programming through leadership, staff training, and quality controls within a program. For the greatest effect, we have to ensure that staff are trained and that program delivery is manner intended. Next slide, please. We're going to briefly go over the major set of risk and need factors. It's very important with respect to assessment and classification, and it's important that the County Reentry Task Force staff are educated and informed on these central 8 factors. As they're listed here: antisocial, pro-criminal attitudes, values, beliefs, and cognitive emotional states; pro-criminal associates, negative peers, or isolation from anti-criminal others; temperamental and antisocial personality patterns conducive to criminal thinking; impulsivity; weak socialization; adventurousness, restlessness, aggressive behavior; egocentric thoughts; a taste for risk; weak problem solving or self-regulation and lack of coping skills. Number 4, a history of antisocial behavior. Next slide, please. Familiar factors, including criminality in the family, a variety of different psychological problems in the family of origin, including low levels of affection, caring, and cohesiveness, poor supervision, discipline, and outright neglect and abuse in some cases. The low levels of personal, educational, vocational, and financial achievement is also a criminogenic need. Low levels of involvement in pro-social leisure activities, which is why we stress the importance of structured recreational time and structured free time. This allows for interaction with antisocial peers when they don't have structured time. It allows for individuals to have idle time. It also allows for individuals to replace pro-social behaviors with antisocial behavior. Substance abuse. In and of itself, most drugs are illegal to use. It incorporates and promotes engagement with antisocial others and can severely impact social skills. So what I wanted to say about these risk factors is that, the COMPASS reentry assesses these criminogenic needs and risks, as well as other needs of individuals. And the risk need factors most linked to criminal behavior, as I stated before, are known as the central 8. So we can discuss dynamic risk factors, which are things that can change, such as your thinking, the peers you associate with, and substance abuse, to name a few. There are static risk factors, however, such as your legal history, that cannot change. I will say that what we do in these situations is connect individuals with cognitive behavioral interventions, because that can impact thinking errors and can influence future pro-social behaviors. Next slide, please. So the needs of the County Reentry Task Force participants are paramount to us. We're addressing both criminogenic needs, which are problem-solving skills, substance abuse, criminal thinking, peers, constructive leisure time, family communication, and education employment, as we just discussed in the Central 8. But we also have to focus on those stabilization needs, because what do we know about individuals who are not stabilized? If they're not stabilized, they're not going to be able to effectively address other criminogenic needs. They don't have housing, transportation. They don't have a relationship with their children, and that's making them very stressed. If they need help with trauma, if they have mental health needs, if they don't have good hygiene, but they can't afford self-care, if they don't have the ability to connect with individuals because they don't have access to the digital world. These are issues that we need to help them stabilize before we can continue to address the needs that are most linked to reoffending behavior. Next slide, please. I'm going to turn my slide deck over to Ben Lazarus from OPDF for the next few slides.
Yeah, sounds good. Thanks, Michelle. So this slide, this is briefly going to cover some of the submission guidance for this term of the contract. So this year, we're going to continue to use the Grants Gateway for the contract development and review by OPCA. It's the same system you've been using for a couple of years now. You should be comfortable, but if you're not or you ever need assistance, you can reach out to the HTTPS URL we have on the slide here, and the grants management team will be happy to help you. Next slide, please. All right, so just a few important plan submission documents continued here. Like last year, the contracts will be expenditure-based. So what that means is you'll be reimbursed for actual expenses. It's a line item budget that will be reviewed here by OPDF and OPCA. It's not based on the completion of milestone targets like it was a few years ago. However, the grantees, you'll still be required to meet measurables, and these will be determined by OPCA with you. You'll have a discussion so you know exactly what they are, and there's what the performance targets used to be. Next slide, please. Michelle, you want to grab this one?
Back to me real quick. So plan preparation and review meetings. I discussed this briefly earlier. I mentioned that Taylor Alfred and Melinda Vick from OPCA will be scheduling these meetings if they already haven't with you. I believe they have. And the County Reentry Task Forces are required to prepare answers to the questions in Part 2 of the guidance document you received. Well, it says before meeting with OPCA, but it would be helpful, if you aren't able to do that before you meet with OPCA, do your best to make sure that happens within the next, few weeks. OPCA will address questions related to County Reentry Task Force program components, service coordination to address stabilization and criminogenic needs, the implementation of your CBI and/or employment readiness programming, the work plan, and overall plan submission. We're going to be there to walk through every step of the way with you. The staffing structure and the need to increase the CRTF staff will also be discussed during these meetings. And I want to quickly refer you to page 6 of your guidance document, paragraph 1, which emphasizes the following. The grantees are supported to utilize 50 to 60% of the amount awarded to their locality for enhanced stabilization services. Funding should also be used to support personal services, including additional staffing and salary enhancements to ensure a stable workforce and the ongoing delivery of cognitive behavioral interventions and/or employment readiness programming. Next slide, please. Back to OPDF.
Yeah, so this slide just very briefly covers the contract terms. The current term that you're in will end September 30th, so basically end of a month from now. And then the term that we'll be working on is basically the focus of this entire webinar is renewal, and that's going to start October 1st, 2023, and it'll go for a year and ending September 30th of 2024. Next slide, please. This one's on subcontracting. For those of you that do sub out your award, in your contract, there's some specific information on how those subcontractors must be procured. The language in there, if you have any questions, you can always call OPDF. We'll be happy to assist you on that. And another thing to note is that for any sub-awardee, all of the contract obligations and requirements do pass through from the grantee to the subcontractor. So it's up to the grantee to hold the subcontractor accountable to all of the rules and conditions that are outlined in the contract and the contract details in the appendices that you'll actually sign prior to going to contract execution. DCGS will also receive a copy of the agreement. We know sometimes if it's a brand new subcontractor that might take a bit to get, but we will work with you to make sure we have copies of that. Next slide. Thank you.
Thank you, Ben. Before I go on, I just want to also mention, this is not in the slides, that we have revamped the memorandum of understanding between New York State DCJS, New York State Docs, the counties, and the county reentry task forces. Within the next month or so, we should be able to get that out to you all, and I just wanted to mention that. So moving forward, the 2023-2024 County Reentry Task Force program goals and purpose have not changed. We're going to enhance them, but the goals are to reduce recidivism and increase public safety, maintain that county-based service delivery system that addresses the criminogenic and stabilization needs of moderate to high-risk individuals and specialized populations, enhancing personal services, including review of staff salaries to ensure consistent staff resources and continuity of service delivery, providing increased stabilization services to ensure individuals' essential needs are met, continuing to provide cognitive behavioral interventions to address criminogenic needs of persons returning to their communities, and last but not least, providing employment readiness programming to help individuals to re-enter the workforce. Just getting back to the second bullet, it was something very impactful that I heard Monday at the APA conference. Someone was talking about why it's so important for there to be a county-based or community-based service delivery system. And that's regardless of a county reentry task force, regardless of this particular program model. And the reason is because individuals coming out of state incarceration are going to need services undoubtedly throughout their lifetime, but they're not always going to be part of the county reentry task force. So it's important for the community to understand the unique needs of individuals coming out of state incarceration, the barriers and the challenges they face, because long after they're completing their work with the task forces, they will most likely need the services from the community. Next slide, please. So during our contract reviews, our renewal reviews, we're going to be talking about program target numbers. The CRTFs are advised to consider data that is provided in the guidance document, specifically the appendix, docs releases, and CRTF program intakes to determine appropriate target numbers for the case conference, the intake and service coordination plan, service coordination, and the CBI and employment readiness objectives. We are going to work with each CRTF to determine the number of individuals to be served for the upcoming contract year during our renewal meetings. The target numbers for this upcoming contract year should allow a high quality intervention to be delivered to as many participants as reasonable, given the anticipated docs release numbers. Next slide, please. So just to give up a recap of the target population, eligibility, moderate to highest risk individuals based on the Compass reentry, cases with a supervision level of 1, 2, or 3. However, supervision level 4 are permitted. These individuals identified as special populations are also eligible for services, and we will talk about them more on the next slide. Individuals who have reached maximum expiration from community supervision are also eligible for reentry services. Individuals who have reached their maximum expiration date while on supervision are eligible. Individuals who have reached maximum expiration and being released from docs with no parole supervision are eligible. Individuals who may have been formerly incarcerated with docs and walk in to receive services to any county reentry task force are eligible for services. Next slide, please. I referenced the special populations in the previous slide. They are women with high service needs, adolescents and juvenile offenders by statute on parole or recently released from an Office of Children and Family Services residential facility, persons with mental health or developmental disabilities, severe medical issues, those with hearing, visual, or physical impairments, those released who have been incarcerated for 10 years or more. This is a change from a prior guidance document in 2019, went from 20 years or more to 10 years or more. Just wanted to make note of that. And individuals who have violated parole and were re-released. Next slide, please. Oh, I wanted to mention real quickly, I'm sorry, prior to going on to the next slide, that people on probation do not fall within the eligibility of the CRTFs unless they're also on parole. Next slide. Thank you, Taylor. The CRTF staffing structure, we were talking about the increase in funding. We are recommending, in concert with that increase, enhancing personal services, including a thorough review of existing staff salaries. This is a priority to ensure consistent staff resources and continuity of service delivery. I want you to make sure that you look carefully at your staffing for each of your task forces. There is a matrix that we're providing to you here with recommended personal services staff based on the number of intakes you'll be delivering. Please reference this and make note and ask questions during your renewal meetings if you have any questions or want to discuss this in any way. But this is something that we really want you to look at as a county, as a task force, to ensure that you have the appropriate number of individuals to provide the quality level of service coordination and providing enhanced stabilization and addressing criminogenic needs for the population that you're serving. I want to talk a little bit about some of those staffing enhancements that we hope that you consider. Coordinators and service coordinators of the task forces, service coordinators, case managers, they're all tasked with hosting and running case conferences, delivering client-specific intake services, facilitating cognitive behavioral intervention and employment readiness group interventions, holding bi-monthly meetings to ensure a consistent and sustainable reentry model of community-based services. So funding for these task forces supports salary enhancements to current CRTF coordinators and support staff to address retention of qualified staff. The addition of funding for positions such as job coaches, community outreach staff, data entry or analysis staff are essential to the success of the task forces and the clients they serve. There are further optional staff enhancements that we will explore, such as family reunification or family-based case management staff, credible messengers, and mentoring program staff. Family and peer support is essential to successful reentry. So family case management and/or family-based interventions for those returning home can address issues such as kinship care and parenting classes. I also wanted to mention here that some of the county reentry task forces employ psychiatric social workers. So this is another staff position that county reentry task forces may want to identify and decide that they need an individual who can address mental health concerns right within the task forces. Next slide, please. I just wanted to mention also briefly, thinking about staffing resources, when you have more time and more staff, to cover the duties, maybe, that'll give you more time to be able to be in the area offices. That has a direct positive impact on referrals when there are staff in the community, in the area offices. So more staff for your task force could essentially mean more time your staff can spend in the area offices, making the connections for individuals who are just coming out of state incarceration, and getting those referrals to the task forces. So talking about staff and personal services enhancements, I just wanted to just restate that enhanced salaries to support the retention of qualified CRTF staff is very important. And the rest of the individual positions or titles here listed on this slide are examples and suggestions for each CRTF in the state to look at and determine whether or not these types of positions could be beneficial to the individuals that you serve. I believe there's a question in the chat that has caught my eye. You mentioned credible messengers as staff. Does this mean people with incarceration history can be hired? Well, that is for sure. We have some county reentry task force coordinators who have had incarceration history And I can't think of a better individual that we have running our county reentry task forces in some part of the state. And it's because of their lived experience and what they've been able to accomplish and achieve with respect to this field and helping individuals coming out of state incarceration that make them so valuable to this process. Next slide, please. So I know PCA has a large portion of this this webinar, but I will be soon turning it over to the Office of Justice Research and Performance in a little bit. But before I do that, I definitely want to go into some of the work plan objectives. You will also be going through all of these with Taylor and Melinda during your renewal meetings. So first and foremost, OJRP, the Office of Justice Research and Performance, will be continuing to collect case level information on all participants who are being served by the CRTFs. There's no change in terms of the work plan and the required case file documentation, performance measures, etc. Want to make sure I emphasize, however, only those who are receiving an intake and a service coordination plan in the County Reentry Task Force will be entered as client-specific information in the CCDS. There will be an aggregate monthly case conference number feature in the CDS someday, but this is a process that we are all still working on here at DCJS. So in the meantime, we still have to ask that the CRTFs provide us with case conference information on a monthly basis to Taylor and Melinda. For each CBI and employment readiness curricula that the CRTF plans to use, there will be notation for that coming up when you do your work plan renewals. Next slide, please. The case conference is defined as the formal plan and structured event with interdisciplinary professionals held every 2 weeks at minimum to discuss service coordination. The CRTF coordinator works with docs to develop a process by which these participants, eligible participants, are referred for case conferencing in advance of their projected docs release date in order to provide sufficient time to identify the appropriate services needed pre-release. Prior to case conference, a signed participant consent form must be provided to the CRTF. And there are certainly required members of the case conference committee across the county reentry task forces. We have to mention here that there are docs memorandums to ensure that all individuals who are eligible for CRTFs are being screened either pre-release or post-release. So I just want to make sure I make note of that. That information has been shared across docs about the pre-release and post-release processes. That process has been vetted and it has been shared across docs with, in the form of memos. And that if you ever have any questions, County Reentry Task Force staff, about processes, please reach out to your docs co-chair or reach out to Taylor, Melinda, or myself. I just wanted to make sure I mentioned that. Next slide, please. So the intake and CRTF service coordination plans. Intake is defined as the initial in-person appointment between CRTF staff and the participant. Parole officers are certainly encouraged to attend whenever possible, but we understand they are very busy with their caseloads. In cases where a pre-release case conference is held, the intake appointment should occur within 1 week or as soon as possible after an individual is released from incarceration. CRTF staff are also responsible for providing a brief orientation or overview of the program, giving individuals the expectations of participation of the program, and while also discussing the benefits of service coordination for the identified needs of individuals coming into the program. Some of the tasks associated with service coordination should include reviewing the needs of the individual, scheduling appointments with or for the individual, making that meaningful connection between a service provider and the participant, not just a card, not just here, call this number, really try to connect the participant with the individual that's going to be providing them services within the community. And following up with service providers, as well as docs, to discuss participant progress. It's important to discuss with docs the progress individuals are making. It will help docs, parole officers, reentry managers to understand when it comes time to closing a case for a participant, because it gives them an idea of what goals they're accomplishing and how successful they're being in the task force programming. Regular reviews of the participants' goals and achievements throughout the time that they're working with the task force is very important. Next slide, please. Continuing with the intake and CRTF service coordination plans, reentry service coordination plans include identified criminogenic and stabilization needs, recommended services, and pertinent information that impacts the delivery of services based on an individual's strengths, individual challenges, and identified preferences of the individual. Service coordination plans should be structured to reflect reasonable goals. What does that mean? We use SMART goals as an acronym at times. So specific, measurable, achievable, realistic, and timely. And a copy of the reentry service coordination plan signed by the participant should be provided to the parole officer as well as the participant. Next slide, please. The CRTF service coordination plan is that plan that really supports the work between the CRTF staff and the participants to secure services to meet the immediate stabilization and criminogenic needs of the individual. These plans are identified reentry goals and include recommended services. The plans should be structured to reflect, as I stated before, the reasonable goals of the individual, goals that someone can achieve and the time frame that they'd like to achieve them. They should be realistic. They should be measurable. The dates and times of appointments and locations of services, frequency of groups and appointments, and the expected duration of a program should be noted on the plan if possible. It just helps to organize an individual, and it will help the participant to see, across a calendar month, for example, or more, when they have their appointments, where those appointments are, the phone number for the individual, for the treatment provider that they're going to. All this is very helpful to help organize an individual by providing them this information in their service coordination plan. Also very, very important, the strategies to overcome the individual barriers and challenges should be noted as well. What are we going to do to help individuals who have transportation issues to get across town, to get to their CBI group? What are we going to do to address someone who wants nothing more than to finish employment readiness, but they have childcare issues? Those are the kind of things that we also have to address. Next slide, please. So we have decided that the service coordination period, and this is based on received feedback from the county reentry task forces over time, that the period of time should be about 30 to 120 days. But that doesn't mean that the period of time that the participant needs to work with the task force can't be longer. So just keep that in mind, that we're looking at that period of time minimally, but that we know that individuals sometimes need to be and want to be involved longer. CRTF staff meet with the participant on an as needed basis, whether it be virtually or in person, telephonically, whatever means necessary to meet the individual where they're at, where they're most comfortable. And this is based on the degree and intensity of their service coordination and their needs. CRTF staff will communicate with service providers to assess progress, get updates from these providers, and periodically review and update the plan that they've created as needed. All service coordination plan updates should be provided to parole staff whenever possible. And prior to conclusion of service coordination, the CRTF staff must review the status of the plan and prepare a CRTF exit summary for the individual as well as the parole officer. Okay, enhancing stabilization services. This is a key component to the enhanced delivery of services moving forward. We talked about this, Deputy Commissioner Macarone mentioned this, it's within your guides document that an increase in funding has been provided to the county reentry task forces across the state. We identified that the amount of funding that you had been receiving for quite a long time was really not sufficient to be able to provide individuals coming home from state incarceration with all of the assistance that they truly need across the state. So with enhanced stabilization services and increased funding, and this is not an all-inclusive list, we would like you to think about using the funding coming to you for a myriad of things. Some of the examples are listed on this slide. Information about these examples are also noted in your guidance document. Acquisition of proper personal ID, transportation supports, housing assistance, including but not limited to even assistance with rental application fees, necessities such as clothing, hygiene supplies, nutritional support, proper attire and footwear for employment training certification fees. They're very expensive in a lot of places. Examples given by some of the task forces were forklift training, OSHA training, and smartphones that enable individuals to stay in communication with services, as well as be able to engage in virtual CBI and employment readiness training. Next slide, please. The cognitive behavioral interventions and employment readiness programs are approved by DCJS. The ones that are approved at this time are listed here on the slide. At any point in time, if you are interested in delivering another intervention, please feel free to share with myself, Taylor, Melinda, and we will review and let you know whether or not DCJS, as a team, will approve a new intervention. Every individual at the CASE conference should be screened for enrollment into CBI and or employment readiness. This is a promise that DCJS has made to docs, that every single person that comes out of state incarceration who is referred to the County Reentry Task Force will be screened for the need for cognitive behavioral intervention or employment readiness programming. How do we determine whether or not they're appropriate for those services? We go back to the Compass reentry. We speak to the parole officer. We have docs representation at the CASE conferences. For example, any individual who has moderate to high risk and antisocial thinking, negative cognitions on a Compass reentry should absolutely be referred to a cognitive behavioral intervention. Any individual who has a moderate to high need established for education and employment on the Compass reentry should be referred to employment readiness. And the first time this conversation should be happening is at the CASE conference. Thank you. Next slide, please. CBI and employment readiness enrollment and completion. We are responsible, CRTFs, to conduct CBI and or employment readiness programs using certified facilitators with fidelity to the model. CRTFs are required to select one or more of the DCJS approved CBI or employment readiness curricula and develop a regular schedule by which these interventions will be available to participants throughout the contract year, not just in the fall, not just in the spring, but throughout the contract year. Document CBI and or employment readiness attendance, please, all CRTFs, with attendance rosters, including dates, times, and participant sign-ins for each module and session. Please work with participants to make up missed modules and sessions prior to the next session. And before we move on, I want to mention another enhancement that I believe could really benefit individuals of the County Reentry Task Forces. Incentives, ways to encourage individuals to complete the programming that they're referred to, understanding that cognitive behavioral interventions, as well as employment readiness, can be lengthy processes. There could be barriers to individuals completing these programs, such as wanting to get a job and support their families. With the new increased funding, please make efforts to incentivize individuals to come into the CBI programming and employment readiness programming, keep them involved, and reward them at the end. We can discuss this further with you individually at your renewal meetings. Thank you. Next slide. The bi-monthly CRTF meetings are, a cornerstone of the CRTFs. This is information that you're aware of. They include a discussion of year-to-date outcomes and achievements. Every time there's a bi-monthly meeting, the coordinator who's presenting the information is giving everyone at the meeting, including the co-chairs, year-to-date outcomes and achievements. The CRTF bi-monthly meeting attendees include the coordinator, co-chairs, and primary service providers from all over the county. CRTFs send a copy of the CRTF bi-monthly meeting agenda in advance of the meeting to DCJS, please, at least 1 week in advance. Also to your co-chairs, to give them an idea about what's going to be presented, but also prior to giving us a final agenda, please make sure that the co-chairs have an input and have an opportunity to put information into the agenda to share at the bi-monthly meetings. A signed attendance sheet should be sent to DCJS upon completion of the meetings. That is not necessarily how it's always done. What we usually get is a electronic version of the attendees from County Reentry Task Forces. And the fact that since COVID, we have essentially pivoted to almost a 100% virtual bi-monthly meeting schedule across the task forces. So having that information sent to Melinda and Taylor within a week or so of the completion of the meeting is very helpful for us to be able to do our comprehensive write-up of your meeting. The meeting space should be suitable to engage all members and foster open communication to anyone that wants to speak. Ideally, meeting space should certainly have phone conferencing capability and audio, video capability. Next slide, please. Community outreach and public education is a work plan objective for the County Reentry Task Forces. Task forces are encouraged to engage the community, including formerly incarcerated individuals and their families, in order to build a comprehensive reentry system throughout the community, and helping individuals understand and connect them to the task forces throughout your counties. Activities may include, but are not limited to, public awareness campaigns, community forums, job fairs, outreach to employers, reentry fairs attended at facilities, publications of informational materials for the community, and other reentry topics. County Reentry Task Forces should also send information to related to community outreach and public education efforts to DCJS in advance of these events so that we can be alerted and possibly attend. Next slide, please. The distance learning modules are also a work plan objective. They're very important. This information in terms of tracking the completion of these modules by staff is the responsibility of the CRTF program. These modules are provided to you on the Integrated Justice Portal. For any of you who need information on how to gain access to the portal and these distance learning modules, please contact Taylor Alfred and Melinda Vick via email, and we will help you gain access. So the distance learning modules include what works, we went over this briefly today, in correctional intervention, staff effectiveness, assessment and classification, case planning, addressing responsivity, cognitive behavioral interventions, behavior management systems, implementation, and client engagement. All these things are really important to for staff, all staff within the County Reentry Task Force, to be able to effectively engage individuals and provide services, coordination, CBI, and to overall help with implementation of your program. Next slide, please. At this point in time, I'm going to be turning the presentation over for about 15 minutes to the Office of Justice Research and Performance.
Thank you, Michelle. Good morning, everyone. My name is Dean Weld with OJRP, and I oversee our Community Corrections Data Submission Application, also called CCDS, which I'm sure many of you are already familiar with. These next few slides will cover the required reporting to DCJS, and then I'll be turning things over to my OJRP colleagues to discuss implementation, fidelity, and evaluation. This slide covers the reporting requirements for the 2023-2024 contract year. Case level data and fiscal reports must be submitted by CRTF, and DCJS has the right to require additional reports for program monitoring and evaluation purposes as needed. Monthly case conference counts should be submitted to the CRTF email address shown on this slide. This is the total number of case conferences that your program does each month, and those emails are received by the OPCA VARE unit. Monthly case level data must also be submitted through the Community Corrections Data Submission Application in the IJ portal. Data for each month are due by the 10th of the following month, and OJRP will send out a monthly email to remind you of those due dates. As Michelle mentioned earlier, I wanted to note that we are working with ITS to be able to eventually collect the monthly counts of case conferences through CCDS. This is currently in development, and we will let you know when that functionality is available. But until we have that ready, those counts should continue to be submitted to OPCA by email. Quarterly fiscal reports must also be submitted for payment. Those are due 30 days after the end of the quarter, and we have the link here on the slide where you can locate those fiscal forms on the DCJS website. The next slide, please. As we just covered on the prior slide, funded programs are required to submit that monthly case level data through CCDS each month. We use your data primarily for three purposes. One is creating quarterly and annual reports that summarize your participant characteristics, program outcomes, and rearrest activity. We also have internal reports that DCJS uses to monitor your program achievements, and the data may also be used to develop cohorts for outcome evaluations. For each of these purposes, DCJS needs to have complete and accurate information on your participants and their progress through the program. So twice a year, we will be sending you a data quality report that identifies participant records in CCDS that might have missing information or possible data entry errors. And when you get a data quality report, there's no need to send anything back to us. You can just go right into CCDS and make any necessary updates. Next slide, please. So the data entry in the CCDS application is required for CRTF participants for whom an intake is completed and an initial service coordination plan is developed. That's an important point that Michelle was mentioning earlier. If an individual is case conferenced but does not end up admitted to the CRTF, please do not enter any data into CCDS. We only want your actual program participants who have an intake and a service coordination plan. The information you're required to enter into CCDS includes demographics, required dates of performance measure achievement, which are the case conference date, the dates when service coordination starts and ends, and the enrollment and completion dates for the CBI and employment readiness interventions that your program is delivering. We also collect the last date of formal services and the reason for end of formal services, which should be reported for every participant when they are no longer engaged with the CRTF. And this is all the same information that CRTFs have already been reporting, so there are no changes to the CCDS portion for the upcoming year. I also wanted to quickly note that on the main menu screen of CCDS, you can click on a button that says CCDS Reporting Resources. That will give you access to the recording of a webinar training, a user guide that was just posted, quick reference guides that provide step-by-step instructions for all the things you need to do in CCDS, which are a great reference if you forget how to do something. And we also have the required fields document that provides more information on all the data elements that are required for the CRTFs to be reporting. And if you have any questions about data or reporting, we have an OJRP mailbox for reporting questions, or you can always reach out to me directly, and that contact information will be provided at the end of the webinar. And that concludes the reporting overview, so I will turn it over to Shanley Corello and Jessica Henkel.
Thanks, Dean. That was great. Good morning again, everyone. We'll be going really briefly over implementation, fidelity, and evaluation, and then we'll spend the remaining time on several slides that just walk you through the concept of a logic model. So over the last few years, DCJS has prioritized fidelity and continuous improvement through assessment, site visits, and technical assistance. We are working to develop and refine our implementation, fidelity, and evaluation system, as Michelle had mentioned earlier, and we will be working with grantees as we develop and finalize our tools and procedures. The case level data that grantees submit to DCJS through the CCDS application will be used to provide feedback reports to grantees, and it may be used to conduct evaluation studies as well. Next slide, please. This is an exciting year for the CRTFs. As we all know, there are additional funds available to support the provision of additional services to help your clients. As we move forward, we ask that you submit a logic model as part of your proposal, and this information is in the guidance document, as well as an example is in the appendix of that guidance document. These slides are an intro to the logic model concept. I'm sure many of you might be familiar with this. You might have already completed one. So we will just walk through the basic elements and note how this might be helpful to planning out your programming and really thinking about the strategies for your upcoming plans. So a logic model is a visual representation intended to help CRTFs and DCJS understand how the program's proposed components will achieve the desired outcomes. As you see here, the elements of a logic model are on the most basic elements: inputs, activities, outputs, and then outcomes and impacts. An input are the resources available to your agency to develop and implement the intervention. And again, we'll go into these a little bit more detail, but I'm just providing the basic overview now. Activities are interventions that you're offering. Outputs would be the measures for those interventions. And then desired outcomes and impacts include both short and long-term goals. Next slide, please.
Thanks, Shinley. So to build your logic model, it can help with to start with if-then statements. So for example, if resources are available to address a problem or a need, then planned activities or interventions can be implemented. Or if those interventions are evidence-based and implemented successfully, then certain intended results, such as outputs and outcomes, can be expected. Building this way is really helpful for highlighting the relationships between aspects of your program. Next slide, please. So what's shown here is just a blank logic model template. We have provided a filled-in example in the appendix sample logic model of the guidance document. I know that this slide has really small font and is difficult to read, so we will go through each component and provide select examples of how they can be filled in. Please note, though, that this example is not meant to be an exact step-by-step walkthrough, nor is it intended to reflect the services that should be included in the CRTF model. We know that each program is unique and will have a unique set of inputs, activities, barriers, outputs, outcomes, etc. Next slide, please.
Awesome. Thanks, Jess. Yeah, I think that's a great clarification to make, is that in these examples, we aren't intending to give you specific items which you would need to put in there. They're just meant to illustrate types of information we would expect to be put in. So in the goals or objectives section, we ask that you describe the intended results of your proposed program. This is an example of a goal that CRTFs will likely have. It should include all of the goals or objectives of your CRTF. So these should be things that, of course, you've already thought through, and information that you're just reorganizing into a way that's visually easier to represent the flow between each points. We encourage you to consider services that your CRTF is proposing to deliver to address stabilization and criminogenic needs, as Michelle had mentioned earlier, and to ensure that program goals are also included in this section. Next slide, please. So the assumptions section should outline expectations or beliefs about your organization and current partnerships that might influence program operations or service delivery. They underlie and influence the program decisions that we make. And at the most basic level, they are principles, beliefs, or ideas about a problem or situation, resources and staff, the way the program is intended to operate, what the program expects to achieve, or the participants in terms of how they learn, their behavior, their motivations, etc. And then one example is that you are assuming that your program will build and maintain strong relationships with your referral sources. Next slide, please. So inputs are resources needed or used to deliver the proposed program activities. They may already be available or need to be acquired to perform these activities. One example would be identifying your referral source as the activity. While potential barriers are obstacles or issues which might prevent successful implementation of program components, it can be helpful to consider these potential barriers, such as legislative changes or pandemic-related concerns, while planning program operations and activities. And I would say, just taking 3 steps back, this seems very technical and very focused, but I think the broader, the better. The natural things that come to mind, your programs better than anyone else. Those are the types of things that we would want to see on that logic model. Okay, next slide, please. And I'll turn it to Jess.
Thank you. So activities are the specific strategies and services that you intend to implement in order to achieve your articulated goals and your articulated outcomes. So these activities should include the required services of the CRTF model, as well as any additional services that you are proposing to deliver that are applicable. Outputs are measurable results that can be used to monitor these activities. The metrics you develop to measure each output will help us determine, or will help you determine, the extent to which you delivered your activities as planned. Next slide, please. Outcomes are the expected short and long-term benefits of your program, and these can be participant-level outcomes, or they can be impacts that are seen at the system level. As you are developing your intended outcome measures, we'd like for you to think through how you will be achieving your intended outcomes. For example, if your program is aiming to improve criminal thinking for participants, will you be conducting a pre and post test to measure criminal thinking, for example, or criminogenic thinking rather? DCJS plans to share rearrest outcomes routinely to help monitor reductions in recidivism. And Shanley will tell us a little bit more about the logic model on the next slide.
Absolutely. So to wrap up, please feel free to refer to the appendix sample logic model. All of the examples in today's slide were pulled from that. They were just zoomed in. If your program has already developed a logic model for this proposed program that includes all of these elements, the goals, assumptions, inputs, potential barriers, activities, outputs, etc., you can attach that document instead. You don't have to create a new one. And then we will continue to provide support and guidance on this. Both Jess and I will be the contacts for that. So please feel free to reach out if you have questions on the logic model component of this. And then I think we are transitioning back to OPCA for the next slide. Thank you.
Michelle, if you want, I can grab this one.
Absolutely. Thanks, Ben.
Yeah, absolutely. So in summary, this is the last final pieces for the contract piece. Your narrative responses to the questions outlined in the guidance document. We're looking to have those back to us no later than September 22nd. If you get them to us sooner, that would be absolutely fantastic. You'll put them in Word format and then attach them to your record and the grants gateway. Another thing to note is that for the not-for-profit grantees, as well as grantees that have sub-awardees that are not-for-profits, these organizations must be pre-qualified and determined to be responsible vendors. So this is your pre-qualification in the gateway, and then your state controller's office vendor responsibility. If neither one of those are met, meaning you're determined to be a non-responsive vendor or you are not pre-qualified, then we cannot execute your contract. So we ask that you start that piece pretty much as soon as you can in case there is some back and forth to get those components finalized. The last piece would be your budgets. So when you update your budgets in the Grants Gateway, you want to make sure that the budget reflects the increase in funding that you're asking for. This is going to be part of the basis that we're reviewing to make sure that the money you're asking is supporting the program components that you are including. So it is very important that you put in a detailed justification so that we understand exactly what you're asking for is substantiated by your program design. So last slide, Michelle, looks like it's going to be questions.
Yes, thank you, Ben, and thank you, Shenley, Dean, and Jessica from OJRP as well. We do have some questions, and I will go through them as I have them. In regards to the staffing matrix, does the coordinator count as one of the personal staff? The answer is yes. Next question is staff salaries. Is there a cap or percentage that is suggested? I think it's important that the county reentry task forces, along with the co-chairs, review current salaries, review the number of staff you have, and develop your budgets. Propose the salaries that you would, like to have in your budgets, and we will then at DCJS go over them, contact you if necessary to discuss, your decision in that regard. We don't specifically have a cap on the salaries that you're going to be determining for your staff. I would ask that either Taylor or Melinda let us know about any other questions that may come in through the Q&A or chat.
I got one other one, Michelle, that I think is fitting for some of our subcontracts. They're asking when it comes to staffing, they may likely fall into the 3-staff range. Does that 3-staff include agency administration, or is that separate from the 3-staff target?
I guess I would have to ask what they mean by agency administration. Someone overseeing a coordinator who's not providing services specifically to returning citizens would not be considered.
Yeah.
With concerns to fidelity to model, let's say, for example, if the individual had to do interactive journaling, could they combine that with another evidence-based intervention, like, for example, anger management or something like that?
Thank you, Limas, for that question. With respect to anger management specifically, not to be confused with domestic violence, very separate. We have been advised that if there is a request by a County Rancho task force to deliver anger management programming, to put that in writing to your DOCS co-chair. We'll go from there.
Thank you.
You're welcome.
I've got a question in the chat. Is there an overall model document or is there one needed for each outcome? I may have to ask that person to elaborate a little bit further.
Sounds like a logic model question, perhaps.
Possibly. And then there's regarding the service coordination plan template, there is a DCJS service coordination plan template that we, encourage programs to use, and it's not a requirement. And we can definitely share those with you at the renewal meetings as well.
Taylor, could you repeat the question with respect to the outcomes or outputs, and perhaps OJRP can assist, or we could ask the individual who raised the question to unmute and speak about it?
Sure. I think you're right. I think it's definitely about the template. Is there an overall model document, or is there one needed for each outcome? So there is a logic model template, but I'd have to defer to Shanley for further.
Absolutely. Yeah, thank you for clarifying that. I was just wondering if the question had more information to it. So you do not need a different sheet of paper or a different template for each outcome. All of the outcomes will go in one specific part of the logic model. And again, you can be as broad as possible with the actual outcome which you're intending. There's actually limited space within the logic model. So it's really intended to be more of like a flow of how all of your resources, all of the activities you do eventually lead to that intended outcome. But that's a really good question. And if you have further questions, I can put my contact information in the chat, and you can reach out directly to me. So thanks.
I think that would be very helpful, Shanley. Thank you. Going back to the anger management question real quick, I just had a thought also. Taylor and Melinda can speak to you about the process for the anger management possibility as one of your deliverables during your renewal meetings as well.
I'm personally not seeing any more come in to me via chat or other ways.
I'm not seeing any either. If anyone wants to unmute and ask a question, please feel free. We'll keep the line open.
With the hiring of new staff, does DOCS co-chairs need to be involved in that interview process or resume review process?
Could you read that one more time for me, Melinda, please?
Yep, in the new hiring of staff, does the DOCS co-chair need to be involved in the interview or resume process?
In this model, we support the task force, non-for-profit, whomever is delivering services, to encourage the involvement of the county co-chair as well as the DOCS co-chair. We want to ensure that all professionals involved in the triad of the County Rancho Task Force structure have some input into the hiring of individuals for no other reason other than, for appropriateness, for perhaps even there may be some connection of the person to someone who works for the county or DOCS. They may know these individuals. So I think it is important to at least give DOCS co-chairs as well as county co-chairs the opportunity to be involved in the hiring and resume review process. Good questions, everyone. Not seeing any, but I do see Shanley's contact information in the chat. Thank you for those of you who want to take that down with respect to the logic model exercise.
I got a question too also. Let's say, for example, guy's about to be released, a returning citizen about to be released, and he has immigration issues. Would that be acceptable for the person to be referred into the program?
what is my understanding is that you could, as a county reentry task force staff, assist the individual any issues that they may have in terms of their issue with that. So I'm assuming that it doesn't preclude them from being involved in the task force by any means. If they're referred to your program, and you could assist them with any that they need with regard to immigration. Speak to docs if you have any questions or concerns about the status of this individual, as well as your supervisor and your agency.
Hello, Michelle.
Hello, Anthony.
Hi. I have a question for Dean. Can you elaborate further on the quarterly fiscal reporting that needs to be done moving forward?
Hi, thanks for that question. I would say that the fiscal reporting is unfortunately not my area of expertise. I'm wondering if possibly OPDF might have more to share on that.
Yeah, absolutely. The fiscal reporting is due quarterly, 30 days after the end of each quarter. There's some additional instructions when we sent out your award notice. There was an instruction sheet in there. There is a contact email that you'll want to reach out with any specific questions you have to our finance office. They handle all of the vouchering.
Thank you, Ben.
Thank you, Ben.
There's also an email address in the chat that Dean Weld provided. It's the OJRP mailbox for data and reporting questions. So please take down that email address if you don't already have it. These are excellent questions. Okay, having not seen any more, I want to.
Sorry, we have one more.
Oh, we do.
Just coming in. Is there a process available to do a budget modification if there are overages? Further, like once the contract begins? That's probably going to Ben.
There are. It will be a grant amendment request, and that's something we look at on a case-by-case basis. We coordinate with OPCA to make sure that it's a reasonable request, and then it does require a modification in the grant gateway. We do ask that that's something that you would really do closer to the end of the term rather than in the middle to see if other performance goals come up. However, in this case, since it's a line item budget, it's not necessarily specifically tied into the performance, more the expenditures themselves. So if there are changes in the budget itself or an overage within a budget line, you'll reach out to OPDF, and again, we'll coordinate with OPCA on that to make sure programmatically it makes sense, and that programmatically to supporting your target goals.
Thank you. Are there any more questions? We do have time if you have them. Okay, having heard none, I'll try this again. The DCGS contact information for each office is listed on this slide. My contact information is here from OPCA, as well as Ben Lazarus from the Program Development and Funding Office, as well as Dean Weld from the Office of Justice Research and Performance for data-related questions. There's also the OJRP ATI mailbox for reporting questions, email address listed here. And I just want to take this opportunity to thank all of you from the County Reentry Task Forces, docs professionals who are on the call, as well as county professionals who attended, as well as Bob Macarone, my Assistant Director, Matt Charton, and all staff from OJRP and OPDF for being here today. We are really excited about this new enhanced stabilization needs and personal services model. We're hoping that you understand all of the information we shared today. We are here to help you. Your guidance document is here to help you. Please refer to it. And we look forward to talking with you all and seeing you all virtually on your renewal meetings coming up within the next few weeks. Thank you so much. This is a recorded webinar, And I will leave it to Taylor to determine how we're going to get this out to you within the next very, very near future. Thank you all.
Nice job, Michelle.